What's up guys, Tony Maritato here, and in this video I want to open the discussion about MPPR, the multiple procedure reduction adjustment that you've seen on your Medicare claims for a long time, but now in a Facebook group somebody shared that Blue Cross Blue Shield of Massachusetts has announced that they're going to be imposing or implementing a version of MPPR, and so it's a 50% reduction on the, I'll tell you exactly what it says, 50% reduction on the practice expense portion of the reimbursement. So there's going to be some calculations going on to figure out what that's going to be, but the conversation went an interesting direction. Now, every time I talk to somebody about MPPR, my position is this is pushing the profession toward more frequent single unit sessions, because I believe that we can do more in a single unit session anyway. I believe there's enough research out there to say, depending on the kind of care that you're providing, in my clinic, it's an outpatient orthopedic. Patients coming to my clinic are typically driving themselves, bathing themselves, dressing and feeding themselves. They're living independently in the community. Cognitively, they're intact. And so really what happens is I spend most of my time educating my patient more than actually doing like a treatment to my patient. So since I'm educating them, a 10 or 15 minute education session to say, okay, Mrs. Patient, this is what we're working on. You have a functional deficit associated with sit to stand. We're going to work on sit to stand today. These are the 3 exercises that we're going to repeat and get the reps and the sets in to improve the quality of this sit to stand. And then after that, it's a matter of doing the reps. So if I have a client that I can show 3 basic exercises and they can retain the information, they can understand what they're doing, maybe they come back tomorrow for another single unit session where we repeat what we did yesterday and do one thing new, and then they come in the next day, we repeat what we've already done and do one thing new. I find that these little chunks of information are easier to digest, retain, and implement. And so with that, I love single unit sessions. I eliminate the negative effect of MPPR for somebody who's doing a 4 unit session. I can still deliver 4 units of care in an hour. Actually, I could deliver 6 units of care based on a 10-minute per unit reimbursement. But let's just be conservative. Let's say I do 4 units, 15 minutes, one-on-one time across 4 different people as opposed to 4 units across 1 person. I've shared these numbers, but roughly for Medicare reimbursement, 4 units, 1 person, we're looking at about $100, usually down to $92. 4 units across 4 different people, I'm upwards of $120 reimbursement depending on the CPT codes that each individual needs. So you're not documenting more, you're not doing anything different, you're still delivering 4 units of care, you're just doing it across 4 different people instead of 1. Now that being said, the conversation at hand that I think is really important is the one around a comment that was made, and I appreciate this comment. Another therapist said, how can you effectively treat someone in 22 minutes or less? I said it depends. First, it depends on your client. Who are you treating? Right? Now, certainly if I'm dealing with a highly complex, medically involved, poor tissue healing and all of these other complexities going on, my clinic is not the right environment for that individual. The same way I don't treat pediatrics, I don't treat deeply involved neuro cases, I don't have the facility to help those individuals. So those individuals should go to a neuro rehab center or a place that's, like I don't do spinal cord injuries because I don't have the knowledge or the infrastructure to handle that. Those individuals should go to a spinal cord injury center, somebody that specializes in that. The other question that was brought up, which I think is a phenomenal question, is this individual was saying they have patients with this particular Blue Cross of Massachusetts plan that is limited to 20 visits a year. Okay, that makes total sense. So I said, with those individuals, do they have a copay, and what's the average copay ranging? And so she came back to say the average copay probably be $30. I know it can be higher, probably sometimes lower. So when we're looking at a situation like this, and this is where I think it gets the most exciting to be a physical therapist in this day and age, I'm a problem solver. That's what I love to do. That's what I want to do. That's what I do best. So if somebody comes to me with an Anthem, Blue Cross Blue Shield, or whatever the Blue Cross is for Massachusetts, and let's say they have a $30 per visit copay, let's say they have a limit of 20 visits per year. Because of the introduction of the good faith estimate, we know that we can issue that individual a good faith estimate to say, if you use your insurance, it's going to cost this. If you want to pay out of pocket, it's going to cost that. And so if this person is in either situation potentially paying $30 a session, I would rather deliver a single unit of one-on-one care for $30 a session, not allow them to choose not to utilize their insurance coverage. The $30 would cover the single unit of session plus access to the facility for the day, which would allow them to do the independent portion of their exercise program. So I'm not saying they can only be in your clinic or my clinic for 15 minutes. They can be on my clinic for 30 minutes, 40 minutes, an hour, whatever it is that I believe that they need. But they're only going to get 15 minutes of one-on-one time with me as the therapist if they're paying for and only need a single unit. So effectively what happens is we eliminate the harmful effect of MPPR. We eliminate the reality of a 20 visit limit, because once they've utilized the 20 visits, if they even want to go through insurance at all, then they could continue to pay the $30 per session, which is their equivalent to their copay, or less, depending on what you're charging them if you're doing a prompt pay discount for a single unit of service. Functionally, we've completely eliminated the barriers to entry. Effectively, if I'm averaging $30 per unit revenue for the delivery of my service, 4 of those units is $120 an hour. That's probably more than you would have been getting billing 4 units to Blue Cross Blue Shield of Massachusetts in the first place. So guys, I know I went through that really quick. I know that some of you might be wondering, like, what the heck am I talking about? If you have questions about it, if you need more depth, if you need more information, let me know in the comments below. Otherwise, my objective here, my goal, my hope for you isn't that you do what I say. It's that you look at the concept behind what I'm saying and you start to look at this more as a problem solver than as a technician. You know, you're not going to work clocking in and punching holes in a board. You're going to figure stuff out. And I promise you, you can figure out how to operate more profitably, more effectively, and have better patient outcomes if you take a little time to forget all of the stuff that we used to do, all of the things that we think we know, and look at the situation with a fresh pair of eyes. I'll catch you on the next video.